Hey, so welcome everybody. Today we're going to talk about what bones you break in an ankle fracture, and as always, we're going to start looking at the ankle from the front in terms of its bony structures. So we're going to start there with the tibia, which is your shin bone, as we talked about before. The little bone next to it called the fibula, which is commonly the one that breaks. The bone in between the heel and the tibia called the talus, which makes up part of your ankle. And then at the bottom there, we've got the heel bone, otherwise known as the calcaneus. Now, the area that you commonly break in the ankle during an ankle fracture are called the malleoli, and a single projection is called a malleolus. So the definition of malleolus is a projection at the end of the tibia or fibula, and these are the things that you break commonly in an ankle fracture. There are actually three of them in the ankle. So we give you a better idea of what they actually look like in terms of the areas where you break. I'm just going to draw this ankle from the front again with the tibia and the fibula marked, and then I'm going to draw an area in red there of the areas that commonly break. So on the big toe side of your ankle, the area you commonly break is called the medial malleolus. So that's commonly common area that's broken. And then probably the most common area you break in your ankle is called the lateral malleolus on the side there, which is at the end of the fibula. So it's a projection of the fibula bone. So you can actually feel your lateral malleolus is on the little toe side of the ankle. Now, I mentioned before, there were three areas where you can potentially break the ankle, and to help you get a visualization of that, we're going to look at what the ankle looks like from the side. So we've drawn it from the front there, follow the eyes. So if those eyes were looking at that bone from the side, this is what it looks like. So the tibia is on the top there. The talus bone actually looks a bit like a peanut from the side, and the heel bone actually looks very different as well. It's not a circle. So there's the heel bone marked there, the talus there looking like a peanut. And so you can get a third type of malleolar fracture called a posterior malleolar fracture, just drawn in red there, which is off the back of the tibia. So you've got a medial malleolus, a lateral malleolus, and a posterior malleolus, and the posterior malleolus just means towards the back. And then to go all with that, we've also got some ligaments around the ankle, which we talked about before. Those red ones there called the syndesmotic ligaments, which can be injured in an ankle fracture. The blue ones there on the big toe side of your ankle called a deltoid ligament, which can be injured in an ankle fracture. And then the green ones there are the lateral ankle ligaments. They're usually injured in a sprain, far less likely to be injured in an ankle fracture itself. But today we're going to look particularly at the bones. So there are three main types of ankle fracture. One is called a unimalleolar ankle fracture, where you just break one bone in the ankle, and that's usually the fibula bone. So you can see there the fibula bone there, we're just going to mark it with an arrow, is broken there. It's got that jagged line through it. And so that's a unimalleolar fracture. A single malleolus is broken in the ankle. And that's probably the least severe of all of them. What it looks like in terms of an x-ray is just here. So we're going to mark it out for you just there, just with the arrow, and that matches up with what the drawing looks like on the left there. So that's a unimalleolar fracture, and we've actually got another talk on those type of fractures. A bimalleolar fracture means you've broken two malleoli, so two areas of the ankle, and that's the drawing there. One break through the fibula, and another break there through the medial malleolus, the big toe side of your ankle. That's broken as well. So two areas of the ankle broken, otherwise known as bimalleolar, bi meaning two. What this one looks like on an x-ray form, we're going to show just on the right here, just so we can match it up with the diagram. So we're just going to draw it for you there. There's a medial malleolar fracture marked out by the arrow, and the lateral malleolar fracture on the little toe side of the ankle is marked out there with the arrow. So that's a more serious fracture and fairly likely to need an operation. And then the trimalleolar fracture, that means you've broken three malleoli, so three breaks in the ankle, and that involves the fibula, usually the medial malleolus just marked out there, and then also that break at the back we were talking about, the posterior malleolus. So that's that marked there. And you can actually get any of these type of breaks in isolation. So unimalleolar can be towards the back, or even just involve the medial malleolus. Now, a trimalleolar fracture, in terms of what it looks like on an x-ray, it's going to look very similar to what a bimalleolar x-ray looks like from the front. So as you can see, the picture is exactly the same, right? Mark there, there's the medial malleolar fracture, there's the lateral malleolar fracture, so the little toe side of the ankle, and then we're going to draw for you what that posterior malleolar fracture looks like. So there it is on the drawing there. And on the x-ray, it's very, very, very small. So we're just in that red area. You see that little tiny break off the back there. They can be much bigger than that, but that's just the x-ray we have for you. So look, I hope you've enjoyed our talk today. If you'd like to view another video on ankle fractures, it's just up there. Or alternatively, please subscribe to our channel. We really enjoy you watching our channels and our videos. And please subscribe to the Foot and Ankle Orthopedic Surgeon. Thank you.